Welcome to Reading and Writing Between the Lines, a podcast series about communication skills in the workplace. I'm your host, John Witzman. Join me as I speak with industry professionals and Conestoga faculty and alumni to explore their journeys with reading and writing skills. Follow us as we talk about how communications learning has changed over the years, how these skills are used in a wide range of industries, and the future of workplace communications. I'm curious to see where some of those other lines went. You talked about the charting, and I'm so fascinated to hear more about that. Is that document already sort of formatted for you with like headings and sections where you are required to fill in certain information? How blank is that page? How much do you have to come up with on your own? What does that chart look like?
So certain charts will actually have things that have already been added. So in the operating room, we have segments for different parts of the chart. Some of those parts are already filled out because nothing changes on the OR. The same procedure of the same doctor happens the exact same way because they don't like to change either.
Okay.
No one likes to change in the OR.
Right.
And so certain parts of that can be repopulated for the charting purposes. So when you're going through the chart, you're putting inputs that anything pretty much is changed with the patient.
Okay.
So it's very easy to do. The charting pretty much for the OR doesn't take that long if you actually focus on it and complete it. What is the biggest thing with charting is the inpatient units.
Okay.
That is longer. You have to put in not only all your assessments and everything, but any conversations you had with family or vital sign changes or something that happened to the patient. I have a physician, an anesthesiologist that's there, that if something goes wrong, he can help me.
Right.
He's the first one to deal with anything. Same with the surgeon. Upstairs on the floor, they don't have anyone. So they have to write down everything they've seen and done, then phone the doctor or try to find the doctor,
right,
and deal with all that at the same time. So that is the difficult part of charting, and everyone hates it because it takes so long.
Yeah.
Like in ICU when I went there for COVID, my charting purposes took almost an hour just for one set of assessments.
Wow.
And you chart every 4 hours your full body assessment, and every hour on the hour you chart vitals. Thank goodness, like the computer is smart enough that repopulates them into the chart, but like that takes time.
Yeah. Translating this through my sort of communications professor lens, it sounds to me a lot like the process of digesting a textbook into notes that are now sort of translatable to some kind of purpose, right? Yeah. They're going to help you to, be successful on the test, or they're going to give you the information that you need to write that essay. But that taking that large set of information, and then filtering out the essential from the non-essential, sort of writing it down in some format that is clear and concise, but also accurate. That's sort of similar to what you're dealing with when you're taking in a patient that they're a live textbook.
Pretty much, yeah.
And that's hard.
It's very hard. Imagine the textbook talking back to you.
Right, exactly.
Yeah.
Yeah, and maybe not even being accurate about its own experience. And that marks the end of another episode of Reading and Writing Between the Lines, a podcast hosted by me, John Witzman, on behalf of the Communications Department and School of Interdisciplinary Studies at Conestoga College. You can find other episodes of this series on our YouTube channel, Reading and Writing Between the Lines. Stay tuned for more episodes. Thanks for listening.